I'd now like to introduce Professor Kim Delbaere. Kim is a Senior Principal Research Scientist at NeuRA and a Professor at the University of New South Wales. Her research has contributed to the understanding of physical, psychological and cognitive factors causing falls using a multidisciplinary approach. Kim has been successful at developing novel methods of applying technology to healthy ageing for over 10 years in both healthy older people and a range of chronic diseases. And this work has been recognised through numerous awards, including some prestigious awards from the NHMRC. The title of Kim's presentation is The Rising Cost of Falls, Why Investing in Prevention Can't Wait, a Call to Action. Thanks, Kim.
Thanks, Daina. And I'll just say I've got lots of animations, so I'm a little bit nervous about this dubious button, but we'll see how we go. So this work has been truly a collaboration between the Australian-New Zealand Falls Prevention Society and the CRE for Falls Injury Prevention, led by Professor Cathy Sherrington. Couldn't have done it without her. She's not here today, but a huge shout out for the fantastic collaboration. We've also been supported by many different organisations that you can see here, with a special thanks to the CEC. I can't see where Lorraine is now, but thank you, Lorraine, for all your support in this as well as the network. So what I will talk to you about today is really our call for action, and I will apply the data that we did on a national level to a New South Wales level. But the first thing that I would like to do is show you a video of the Launch for Action, which is also showing a consumer representation as well from Bob Barnes and David Barnes, who's his son from Lismore, who have done fantastic work and continue to do fantastic work with Rotary, as well as a famous Australian you might recognise. I won't give it away just yet.
Falls prevention is an important problem. Falls is an important problem in older people, and we have an ageing population. Now we have 4 million Australians aged 65 and older, and in 20 years that will be 6 million older Australians. And injuries as a result of falls, they are a growing problem. And as you can see on this graph, falls is absolutely by far the leading cause for injury-related hospitalisation.
We have to say fall injuries continue to rise, and the treatment of these injuries now costs the economy $2.3 billion every year. So clearly, preventing falls and managing fall-related injuries is an urgent health and economic priority, so investing in falls prevention across Australia simply can't wait.
Now, I had a couple of small strokes which have affected my balance, and late last year I fell full length in my lounge room. Fortunately, no broken bones. We don't all die or are hospitalised. I just had very bad bruising. Having a fall sentences you to social isolation and loneliness, particularly if you live alone, far from close family. But even if you live with family, you can sometimes be bedridden, most often housebound, and at best you have limited mobility, certainly limited independence and social isolation.
It burdens me to tell you that my own dear wife, Helen, became a falls risk. She developed shingles in her eye last February. It really knocked her around, and she's still in constant pain. She was on heavy medication and had a couple of busters. But after one of her falls, the ambulance was called. It's unsettling to be in your pajamas at 3 a.m. with paramedics in your bedroom. Now, I'm not an educated man, but I do know falls don't discriminate.
So we're here today because we really want to call on the government and make it very clear why we can't wait to invest in falls prevention across Australia.
We were able to conclude that there was high certainty evidence that exercise can prevent falls.
Exercise is one of the most important things we can do from a falls point of view, and researchers pointed that out. And basically, from my point of view, I really think that exercise is the best thing since sliced bread, which people have already heard this before. But I do know and I believe and I have seen this happen in real life. Improvements are possible no matter what the age. When I'm coming into a lot of times when older people come into my classes or come into a program, the biggest thing that I see is fear, apprehension. People really don't believe that they can do things. They are fearful of hurting themselves. They are fearful of things getting worse because exercise might exacerbate, say, something like their arthritis. And so basically a lot of the time is the exercise program, yes, the content is important to include balance and strength, but one of the big things is helping people really regain their belief in themselves and know that they can do a lot more.
We definitely hope that we can create something here and make a change. We absolutely need the government to make sure that there is that the health system is supported to deliver these strategies. That is what we need the government for. And that is why our key recommendation is to develop a 5-year national prevention strategy accompanied by long-term funding strategies with budget allocation to support the implementation, oversight, ongoing monitoring and review.
I said that I'm here today to speak on behalf of the older generations of Aussies and to help get a message to Australia. Well, as older Australians, we would love to see a big wake up about falls prevention. Helen Spall's story is a good story, but sadly Pam's story is not. Everyone in the country should ask themselves, what will the story be for them and their loved ones?
So you saw our little famous Australian Diana Olsberg from Old People's Homes for 4-year-olds. It was wonderful to have her there, and Sally as well, who is very famous here. So what I thought I'd do, rather than just reiterate what's been said in the video, is to just present a bit of data from New South Wales. And we've been very much assisted by the CEC to gather this data. But our population is aging just as everywhere in the world. We have 1.4 million older people now, 65 and up, but in 10 years that will grow by 27% and 45% in 20 years. But where the numbers are even more stark is in the people aged 85 and up, where we have 180,000 people now, which will increase by 37%. And I'll just let you ponder on how much it will increase in 20 years' time, just for a second. But there will be about double of older people, 85 and up, which we know is one of the most critical points, where we have 50% of the people falling, of which half will fall multiple times. So what does this mean? There's falls injuries as a result of falls and hospitalizations. Here you can see the 0 to 64 old people. And there is an increase, but this increase is way more stark in people 65 and up, where already in the past 10 years, there has been a huge increase from 27,000 to 41,000 older people being hospitalized this year. And today, there will be 114 beds that have an older person in them because of a fall in New South Wales. If we think about the number of fall-related hospitals, so we're looking at quite huge number increases to 60,000 people in the next 20 years. And this is just another way of representing this on a daily basis. So we really need to do something now. And it's not just the hospitalizations, there's just a huge burden on the healthcare system. If we take the example of a hip fracture, if you've had a hip fracture, the average length of stay to stay in hospital is 10.2 days. But there's more than that happens. There is also what happens before. There's ambulance call-outs, there's ambulance ramping, presentations to ED, for which we don't even have accessible data at the moment. It's something we need to change. We need to find that data. And then afterwards, we have rehabilitation, which is often even under-recognized because there's not enough spots. And then additional caring duties for families as a result. And we also know that about 10% of all older patients who attend ED for a fall will actually end up in a nursing home as a result. And about 1,200 people die as a result of their fall. And what's the cost? Because this is what government likes to hear. If we look at the treatment of injuries from falls in New South Wales alone, in 2021 we had 710 million per year, but that is not including all those flow-on effects in relation to ambulance and loss of independence and family impact. If we think about all the fractures in relation to falls across all ages, and we divide it up in people younger and above 65 and older, you can see that the 65 and up are the majority of people ending up in hospital for all fractures. But if we think about another fracture that I mentioned before, hip fracture, it is even more stark. So 91% of all hip fractures in our New South Wales hospitals is by older people who had a fall. And that is huge and something that needs to change. Another very much underrepresented and under-recognized consequence of a fall is a brain injury, where you can also see that almost 70% of the brain injuries related hospitalizations because of a fall is in older people. We know what to do. Like, there's been lots of talks, and Steve's talk was excellent to lead into this. We know what to do. There's been years and years of research. We can reduce falls by 30%, but we don't have a well-implemented strategy. We don't have a policy. We need targeted interventions for people with specific fall risk factors and exercise for everyone, targeting functional abilities, balance, and strength. We will be led by the World Guidelines, which have been published at the end of last year, which is very clear in distinguishing 3 different key groups where different strategies will likely apply. We have the low-risk group, where we're very much trying to target education and advising physical activity levels, like we've heard a lot from Francis and Anne on that. Then we have the intermediate risk, where we really need more tailored exercise programs and education as well, and the high-risk group of people for whom we will have the cataract surgery, potentially for tailored programs and other multifactorial interventions. Steve and Kathy, with others, are leading the Australian guidelines, and they will be, as Steve mentioned, ready by the end of the year, and this will also be embedded in there. So these are our 5 key recommendations that we set out. They were briefly presented as well on the video before. But we want to establish a national coordination group. We want to develop a 5-year plan, engage all levels of government. We've heard this sentence before. Include fall prevention strategies across the lifespan, so not just starting at 65, and a greater investment in translational research. And that's something that we can do as researchers as well. So where are we up to now? So we have been working with experts in the field to come up with a systems map, because falls prevention, it involves all different levels. We have to think about demographic factors and equity factors in culturally and linguistically diverse populations, First Nations people. There's individual risk factors that we need to consider in relation to chronic conditions, but also walking speed, physical function. Organisations, both local, state, federal, non-government, aged care settings, rehabilitation, they all have to be involved and we all have to collaborate. We've got the same mission and we really all know what to do, but we have to work together. Setting up policies, best practice guidelines, and not be afraid of a bit of commercial participation potentially as well if we're looking at technology. And these actions, these intervention actions that we know work. So what we have done very recently, just about a month ago, we were invited by the Clinical Excellence Commission to sit around a Falls Round Table, where we asked a group of experts and representatives of various organizations 3 questions. We asked what's happening now and what are your challenges and opportunities? What could you do with unlimited resources, so a bit of blue sky thinking, and what will you do? And this last question is really where we're at now. So where we will be hoping to get some commitment from these organizations so that we can actually get actions happening now for New South Wales. So we will keep thinking around our systems map, where we are really calling on all the individuals. So I'm talking to all of you here, teams at the front line, to really address the risk factors and what we know about falls prevention. What can you do to make a change, to implement structured exercises and those targeted interventions, but also something that got mentioned by Francis before, addressing the ageist attitudes and the stigma around falling. It's out there and we really need to address it. And every individual can do this. Also, we need organizations, so any managers and representatives of organizations who are here, we need coordinated efforts within your organization, but also across organizations to ensure that we have those evidence-based interventions and supportive environments that can deliver those interventions that we know that work. So integration of these falls prevention strategies and also accessing or facilitating easy access of exercise programs, for example, with a shade. And then the broader healthcare system as well, and that's where we need the systemic changes. And this will be hard, and we hope that we will get there. We're still on our way, but we really need to develop the frameworks for the states in New South Wales and other states. Have our policy back. We haven't had a policy for 10 years. Like, where did it go? You need a policy to guide funding. So we all need to be advocates. And we really should also engage. I'm a bit media shy, I'll say it, but we really should be doing that and talking to politicians when they're standing at the train station. I've done that for the first time in my life a few months ago, to actually talk to them and say, well, this is an important problem, what are you going to do about it? So that's my call to action to you, to help us drive the change. And we created a wonderful report that there's a few copies out there on the network table, but you can also get it from the Australian New Zealand Falls Prevention Society website. Thank you.
Thank you, Kim.